The broadcast is now starting. All attendees are in listen-only mode.
Welcome to the Ohio Commission on Minority Health's Demonstration Grant FY 2020 Application Technical Assistance session. Today we will go over the guidelines of the RFP and the Demonstration Grant application, as well as going into our new grants management online system to take a look at an example of what a grant will look like. For some background on the Commission for those of you who are not aware, in February 1986, the Governor's Task Force on Black and Minority Health was appointed to determine the reasons why disparities existed between the health status of minority and non-minority Ohioans. In April 1987, a task force issued a final report including 12 recommendations. The 12th recommendation called for the establishment of a Commission on Minority Health. The Commission was established on July 1, 1987 by amended Substitute House Bill 171. The Commission is interested in funding projects which are innovative, culturally sensitive, and specific in their approach toward the reduction of the incidence and severity of those diseases or conditions which are responsible for excess morbidity and mortality in minority populations. Health promotion and disease prevention activities will constitute the primary focus of projects funded by the Commission during fiscal year 2020. Minority groups are defined as African Americans, Hispanics, Native American Indians, and Asians. Grants will be awarded on a competitive basis to community-based agencies or organizations with valid 501c3 and designations and status. The request for proposals has a maximum funding ceiling of up to $70,000 per year per applicant agency. Only one application will be accepted per agency, and the fiscal year will begin July 1st and end in June 30th, 2020. As with all grants, funding is contingent on the approval of the state budget and the availability of funds. Grants will be effective July 1, 2019 with an immediate startup required. This must be reflected in the recruiting, hiring of staff, in the first month in the immediate implementation of program activities no later than the second month of the first quarter of funding. Again, this is a performance-based grant. The 2021 year of funding, which is year 2, is non-competitive, but is contingent on a change achieving a proportionate level of projected outcomes during the first year of funding and the availability of funds. The Commission reserves the right to terminate the grant prior to the second funding cycle if the project does not perform in accordance with stated measurable outcomes. The Commission will not seek funding for the following proposals. Proposals which seek funding to support residential services, when treatment constitutes the primary service, which requests funds for the purpose of construction or renovation, conduct research or studies independent of service delivery, which are legislatively mandated or funded by other public dollars, exclusively designed to conduct conferences or workshops, or agencies previously funded by the Commission on a fiscal year or biennial grant award using the same model to continue service delivery. So if you are reapplying, you must have an expanded model of service delivery. All applications for the demonstration grant must be submitted in our new online grants management system by June 3, 2019. Any application or supporting documentation submitted after that date and time will be returned without review. Hand-delivered, faxed, mailed, and emailed applications will not be accepted. Applicants must allow for sufficient time to submit the application in the new system. Since this is a new system, we strongly advise that you allow enough time for any questions you may have to be both submitted and responded to. The submission of a technical assistance request regarding the application guidelines in the MHM system during the application period will not change the application due date. You must demonstrate that at least 20% of the project funds are received from sources other than the grants awarded by the Commission. be a public or private organization which has a valid 501c3 at the time of application and continued on throughout the program. Develop and establish a management board for the administration of the grant composed of proportionate representation of the population to be served and submitted to the board composition form with the grant application. And you must provide services in close proximity to minority communities or include minority communities in the stated service area. You will be ineligible for funding if you are an individual, an organization that does not have a valid and active 501c3, national organizations. So if you're a local chapter or affiliate of a national organization, you may be eligible if you meet the definition of a community-based health group. You are ineligible if you're an organization applying for the sole purpose of acquiring funds to supplement existing programs without any plan for enlarging your scope of work. Organizations in the process of creating or starting a community-based health group for the sole purpose of applying for grants from the Commission will be deemed ineligible. So critical elements of the grant are as follows. Culturally relevant health promotion and disease prevention constitutes the focus for this grant program. Behavior change resulting in improved health status and outcomes is the goal of the Commission. Therefore, grants that rely heavily on screening services exclusive of interventions will not receive high priority. Applicants must comprehensively address the reduction and elimination of known risk factors in program design. For this year, OCMH has determined that grants designed to prevent type 2 diabetes and cardiovascular disease will be considered for funding priorities, but that does not mean you cannot submit grants for our other priorities that are listed in the RFP. Attention should be paid to the method of implementation section under proposal preparation. Applicants should clearly and succinctly, due to application text, box character limits, delineate and explain the methodology that will be used to demonstrate measurable behavior change. Priority will be given to grantees who are able to provide services to a proportionate number of individuals per fiscal year based on your funding request. In designing the proposal, it is important to note that the Commission is interested in new, innovative, and culturally relevant program models. This program should not be viewed as a supplement to the agency or other systems. School-based programs must be budgeted and programmed for the entire 24 months of the grant and cannot be limited to the school year. The Commission requires that proposed service delivery in a school setting to also contain a community component involving all or some of the family unit of the school participants based on established criteria. The Commission requires full pre- and post-evaluations of a summer proportion of a school-based program to include mandatory clinical measures. For questions about the mandatory clinical measures, visit the Commission website at www.mih.ohio.gov and click on the Evaluation Guidance for mandatory clinical measures. All funded grantees must participate in the Ohio Commission on Minority Health Month kickoff activities for 2020 and for 2021 if funded. You must conduct a minimum of 2 Minority Health Month events during April 2020 and again for 2021 if funded in year 2. Demonstration grantees are eligible to apply for separate 2020 Minority Health Month grant funding. However, failure to obtain separate funding will not remove this requirement to host the events. Critical elements of the grant as continued are an acknowledgement of terms will be provided electronically within the MHGM system to grant recipients after the awarding of the grant. This document must be uploaded and submitted to the online system, and responses to all special conditions and other requirements will be uploaded to the system as well. All grant recipients must have a fully executed AOT as well as compliance with all identified program and fiscal special conditions within 60 days of the grant notice. Failure to meet this requirement will result in forfeiture of the grant. All grantees must participate on monthly statewide calls and trainings. All funded grantees must complete and submit quarterly program, fiscal, and evaluation reports to the MHGM system. Again, this is a performance-based grant and based on the availability of fiscal year funds. Grantees who are not up to performance level by the second quarter during the first year of funding will be required to attend a performance funding status meeting here at the Commission. This will also apply to subsequent quarters throughout the funding cycle. Again, the Commission reserves the right to terminate the grant prior to the second funding cycle if the project does not perform in accordance with stated measurable outcomes. So all of you will be new to our new system. A pre-recorded MHGM technical assistance session was recorded on April 24th. Applicants can access the pre-recorded session that provides an overview of how to register, access, and apply in the system. This can be found on the Commission's website at www.mih.ohio.gov under Grant Opportunities. Responses to the RFP application should be prepared following the guidance in the RFP. Proposals that do not provide all of the requested information or do not meet all of the requirements specified in the RFP will be determined incomplete and will be disqualified. So all of your application answers will be found in the RFP. Your system's answers will be found in the applicant user guide, which can be accessed on the Commission website at www.mih.ohio.gov. The sections of the application are as follows. If you're new to the Commission, this is kind of the structure that the application will follow. If you're not new to the Commission, you should recognize all of these sections as sections you've seen previously in paper applications. They're now just going to be transferred into the online system. And now we will go into the system and look at a sample application. We'll give it a minute to load. All right, so now we'll go and search for the grant application. And again, this is a made-up application for demonstration. So again, if you'll see on the left-hand side of the screen, the sections of the application that you'll have to fill out. So we'll start with the face sheet. So again, the face sheet is just your information about what grant you're applying for, the amount of funding, and then the executive director, project director, and fiscal officer. Again, please make sure to fill in all of the sections that have asterisks in them. Once you're completed, you will then click next and you will go to the next screen. So the next screens are just, information that you've seen before if you're not new to the Commission. Organization information, project abstract, proposal narrative, and you'll see these lines down at the bottom of the screen. This will show you a character count, so please make sure you take that into consideration when writing out your responses, that it counts as characters and not word count. So again, you'll fill out all of the asterisk information. You'll do a staff description page, your method of implementation and page, and again, these are all of the same questions if you're not new to the Commission application process. But I suggest you go through and read the application ahead of time and go through the sections just so you can prepare ahead of time. Your project action plan, this is where you'll fill out your goals and objectives, and this is what will come from your quarterly reports. You'll have to fill a line item budget out, your project documentation, and then an electronic signatures page, and then you'll submit the report. So again, I suggest you log into the system ahead of time, create your organization, create yourself, and then go in and really take a look at the application to see what is needed. Please gather all materials needed to complete and submit the application ahead of time. Please be aware that your application session will expire after 30 minutes if you are inactive in the system. So in the live system, there will be a countdown clock at the top of the page. And if you're inactive in that page, when the clock hits 5 minutes, a pop-up will be displayed. The pop-up will ask you if you want to continue. If you're not at your desk, the system will log you out. When logged back in, an indicator triangle will show up and ask if you want to retrieve your unsaved data. If you are still working in the system, it'll just automatically refresh for every 30 minutes. Click the next button to save and advance to the next section of the application. Again, fields with red asterisks are required, and character counts will be included in every section, not word count. So if you're entering your responses into in a separate Word document prior to entering them into the system, please make sure you have character count on in Microsoft Word and not word count. Some required reporting and participation requirements. Uploading the signed acknowledgement of terms and responses to the program special conditions. Submission of program fiscal and evaluation reports. Ensuring program evaluator reports are reviewed by assigned REAP members prior to your submission to them in the system. Participation in Minority Health Month kickoff events. And ensuring that your REAP evaluator and program director will participate in face-to-face calls, webinars, and meetings. So the reporting will look a little different than in previous years. And if you are awarded a grant in our startup meetings down here, we will review the quarterly reports, but you'll have a first quarter, second quarter, third quarter, and fourth quarter and fiscal program evaluation report. And then you will have questions added on to the fourth quarter report in the first year, which will constitute an annual report. And then questions added on the second year, which will constitute as your biennial report. Again, you will have 60 days to complete a fully executed acknowledgement of terms and special conditions. Again, the due date is June 3rd, 2019. I suggest you all look at the systems training if you have not done so yet. And again, June 3rd, 2019, and we will now take questions.